Industrialization has indeed changed the economic profile of the country and people, but it has brought in its own set of problems, at least on the healthcare front. The air we breathe today is not safe, at least in metros and cities. We all know Delhi is choking and Mumbai is fast getting there. This polluted air is giving rise to a host of respiratory diseases like asthma, wheezing, and chronic obstruction pulmonary disease. So how do you fight these respiratory problems? Is there a way out? That's a talking point. Joining me on the show is well-known chest physician Dr. Ashok Mahashur from Hinduja Hospital. Dr. Mahashur, welcome to the show.
Thank you.
Doctor, we will begin by asking you, Delhi and Mumbai seem to have emerged as the pollution capital of the country. Air quality index in Mumbai is 224, in Delhi it is 400. I think it should be anywhere between 0 to 100. So are you seeing the case of respiratory problems, people with respiratory one coming to you very high these days?
Definitely. I think one of the diseases or disorders of a particular system which is fast growing is the respiratory system. We are seeing a large increase in the number of asthmatics, number of chronic obstructive pulmonary disease patients, and not only that, even the children, they are showing increased symptoms of breathlessness, wheezing, frequent respiratory infection.
Why is children more chronic to this problem? Is it because their heart is young, or they are young people, or lungs are young? What is the reason they are getting, or is it hereditary?
Well, children are growing. Their immune system has not yet built up. Their airway size is small, and therefore the effect of viruses and pollution is seen more in children. Similar thing happens in the elderly, but children seem to be more prone for the effects of the external environment on their body.
Is asthma or this respiratory problem gender, is that a gender bias? Do women get it more than men? That's what some studies indicate?
Yes, the studies do indicate, though it is very difficult to correlate and the exact cause finding is very difficult, but about 1.2 times asthma incidence is seen more in women than in men.
Though they are at home, they still get asthma.
That's right.
And they're not going to workplace and things like that.
Yeah, because asthma has got varied factors which lead to this particular disease, and therefore anyone can suffer. But the studies have shown that women are more prone for asthma. Not that indoor environment is safe.
Okay.
They definitely are exposed to certain pollutants even when they stay in the indoor environment.
Doctor, if you look 5 years back or 10 years back, the number of patients visiting you and today, has it gone up astronomically?
Phenomenally increase. Every year there is a rise in the number of patients attending our outpatient clinic.
Okay.
The number of patients who are getting admitted for the respiratory symptoms. So there is definite rise in the incidence of respiratory.
So would you say it is an urban phenomenon, not so much in rural India where there is supposed to be green lungs there?
Partly yes, but in India, what we call as chronic obstructive pulmonary disease is quite often seen in rural areas also, because the fuel they use, the kitchen which is constructed in such a way that it is poorly ventilated. So chronic obstructive pulmonary disease incidence is higher even in rural areas. But urban, of course, due to pollution, the incidence of these disorders is much higher.
So if I have to take the ratio, if there are suppose 10 people suffering from asthma, how much would be urban and how much would be rural?
I would say about 7 to 3.
70%.
7 asthmatics in an urban environment and 3 asthmatics in the rural environment.
So is asthma hereditary?
Yes. Asthma, the main problem is the hypersensitive airways, and these are genetically transmitted. The allergies are genetically transmitted. Therefore, there is always a possibility of allergy getting transmitted genetically. So there is fair chance that if a person is suffering from asthma, his family members would also have asthma.
So if I have it, my children may have it?
Yes. In fact, majority of the patient in asthma, they give a history of some family member having some sort of allergy or asthma.
So the other thing is, in India, approximately 30 million suffer from COPD. And I was told 500,000 die every year.
Yes.
And according to WHO, this could be the third big killer disease by 2020.
Absolutely.
So how do you fight this COPD?
Now COPD
is here to stay?
COPD is a different disease than asthma.
Okay.
The outcome in COPD is not as good as in bronchial asthma. It's a progressive disease and it is mainly caused by smoking and also non-smoker COPD, which is caused by environmental pollution, air pollution, the working environment, poor nutrition, all this leads to COPD. We can only make the life of a COPD patient comfortable and slow down the decline of his lung functions and death, but there is no cure for COPD.
So it is like diabetes, it dies with him.
That's right. So the best thing is to take precautions, avoid smoking, and you can be protected from COPD.
So this COPD is predominant only for the smokers?
Predominantly, but in India, as I said, there is non-smoker COPD due to the wood burning, coal burning, air pollution. These are other causes which can lead to COPD.
Okay, doctor, other thing I want to know, how does India compare with developed countries where asthma is concerned, or wheezing is concerned, COPD is concerned? Is our tropical climate one of the reasons we are getting the more incidence of asthma compared to the West?
Well, I don't think so. Most of the time, the asthma incidence is almost similar. World over, the asthma prevalence is increasing. Even in India, it is increasing. So therefore, it's the allergens and pollution. So asthma incidence is quite comparable in India to the Western.
So it's not that countries. They have less incidence of asthma, we have a higher rate.
No. In fact, New Zealand tops the list of asthmatics because of pollens.
Pollen, okay. Despite decades of intensive studies of asthma, its underlying causes are still not unknown. That's what some studies says. Your comment on that?
Well, in asthma, I always say, is a multifactorial disease. In some, it could be just hereditary. In some, it could be psychosomatic, where the stress triggers asthmatic attack. In some, it could be due to pollution, it could be due to dust, cockroaches. So it varies from country to country what type of allergen one is exposed to.
So what happens in India may not happen in New Zealand, it will be different regions there.
The basic problem in asthmatic is hyperreactive airways. Their airways are very sensitive compared to a normal person. So these people react to any trigger or any stimulant by their airways going into constriction.
Okay.
And they complain of breathlessness. Therefore, identifying a cause is extremely difficult in a given asthmatic patient.
So would you say asthma is also a psychological condition?
Psychology definitely plays a role. Whether it plays a role in causing asthma or worsening the existing asthma is a dilemma. But in most of the patients, it worsens the asthmatic symptoms.
So if I were to ask you, what are typical triggers for asthma or wheezing? Is it anxiety, air pollution, smoking, the food we eat, the weather change, or the perfume? What is the one big cause of it?
All of them. But if I have to tell you, I think dust is the most common source of allergen. The house dust mites, the microscopic insects in the house, which are responsible for asthma. Apart from that, any strong irritant smells. In India, cockroaches have been found to play a dominant role in the household allergies. Then certain chemicals, drugs, these are various allergens which play a role, but dust continues to be a dominant allergen to cause.
But can anybody get asthma? What I'm saying, suppose for the first 30 or 40 years of my life, I had no asthma. Can I get asthma a little later in the life?
Usually asthma is a young age onset disease. And asthmatics usually are born with hyperreactive airways. So if they are exposed to constant irritants for many years, then there is a likelihood that they would get asthma for the first time in the later age. Otherwise, asthma manifests early in life.
Is there any way we can nip it in the bud in the early stages?
As I said, the person is born with hyperreactive airways. Therefore, the cure...
It's like a genetic...
That's right. We do not talk in terms of cure, but today, with the available medications and proper precautions, it can be totally kept under control and the patient can lead a normal life, live a normal duration of his life.
Okay, doctor, you have been treating patients for many years now. What are the profile of people who come to you in terms of age, in terms of sex, in terms of gender, in terms of income group?
Yes. Now, if we analyze them, when it comes to asthma, it is usually younger age group.
Okay.
It is usually children, then they outgrow it, and again around adolescence the symptoms come back again. So young people is the dominant population. Middle-aged women, that is around 35, they can get asthma. So that's the population. Usually it's very rare in elderly person to have bronchial asthma.
Very rare?
Yes, it is usually COPD. It's a chronic obstruction which does not respond so well to treatment in the elderly people. So it can be poorly treated asthma going into COPD in the old age, or they are developing COPD due to various factors in the old age. But asthmatic population, dominant, younger population, middle age, women population.
So would you say how many people would be entering this club every year? It's not a very good club to enter, but I was told that 20 million asthmatic in this country.
Yes, there are 20 million, and the predicted thing is around 2 to 38% prevalence. There are addition of these many children, and around 5 to 20% of adults are added to asthma club every year.
My God. Can it be fatal, doctor? Asthma or wheezing or COPD is fatal? Which is fatal? How many people succumb to it?
If the person does not take care, does not follow proper medication plan, does not follow the advice of avoidance of allergens, then he can land up into acute severe asthma attack which can be fatal.
Doctor, various studies have shown that bone loss and diabetes are probably the biggest side effect of asthma medicine. So how do we tackle such side effects?
Well, there are side effects, but the judicious use of these medications prevents that. And that's why inhaler medications are very safe. They are not going to the system and causing side effects. So an optimum dose of an inhaled medication helps in controlling bronchial asthma and also preventing the side effects.
So what would you say is the economic impact of people suffering from asthma to the family, to the company and to the country at large?
It's a huge impact. If a person is suffering from asthma, he spends a lot of money in medications. Because of his poor quality of life, he cannot do the work, the job, so there is absenteeism and there are frequent doctor visits. His social life is ruined, his financial burden increases, and therefore I think it has a huge economic impact.
Okay, now let me get to the solutions part of it. What are the ways to control it? Some people are talking about pranayama, some people are wearing masks, some people are talking about steam inhalation. So what are ways to control it?
I think the first step is to get it diagnosed correctly. Because all that wheezes or all breathlessness is not due to asthma. Sometimes there are misconceptions and wrong labels are put, wrong treatment is given. So with the help of lung function tests, which is an objective test, diagnose it correctly. Once diagnosed, I think there are two types of medication plans which one must stick to. One is to prevent asthmatic attack and control the symptoms. As far as other therapies are concerned, I think supportive treatment in terms of diet, exercise and avoidance of allergens are extremely important along with the treatment of bronchial asthma. Otherwise, the treatment will not be effective. The other pathies like allopathy, homeopathy.
That's what I was coming to. Whenever people suffer from asthma, they go to allopathy and then suddenly somebody says, why don't you go to homeopathy, it will cure you, or do this Ayurvedic treatment, it will cure you. So what the patient is suffering from a dilemma. What is your advice would be for such people?
My advice is, I think you must have a medicine plan which is more scientific and has proved the test of time, and allopathy medications have done that. There are occasional patients who respond to homeopathy and allopathy well. So there is no harm in trying, but you must have an objective assessment of your lungs whether you are improving or not.
Okay.
Without that, if you go on taking any treatment, you don't know what's happening, then the chances of fatality are higher in asthma.
On the prevention part, nowadays we see a lot of companies advertising about the air purifiers, keep it at home. Does it work?
Yeah, if you are directly exposed to the dust from the vehicle, etc., and you are at a traffic junction, your house is there, there's a lot of dusty environment, the air purifiers are very good for people to have a clean environment.
Okay.
So it is recommended.
So coming to now, we are living in the city in urban India. Pollution is the way of life. So how do we fight it? We are to make our living in urban India only. We can't go to rural India. Nobody knows farming. So what is the way out for such
I
people?
think that's extremely important. When we talk of pollution, everyone says that pollution should be removed. It's not an easy task.
Yeah.
It is everyone's responsibility. Control of source of pollution and control of its effect on the body. So control of source, as I said, vehicle are the most dominant component to cause pollution. So proper traffic management. I would not go into the details of it, but a good transit system, public transport system, etc., lesser number of vehicles, smooth flow of traffic reduces air pollution due to vehicles. If simultaneously an asthmatic or a healthy person should try to build up his immunity.
So how do you build
By that I mean a lifestyle. Now it has been shown that people who have green leafy vegetables, milk products and regular exercise have a lesser incidence of asthma than people who have non-veg and meat every day. Their BMI, body mass index, is either too low or too high. They have more prevalence of bronchial asthma. So one should do regular exercise, proper, fresh, nourishing diet. Any diet which has got chemicals or additives, etc., is likely to irritate your breathing tubes and give asthma. So lifestyle modification, proper diet, regular exercise, and avoidance of exercise during pollution season.
Especially during the winter.
There's an inversion. Exactly. So if you inhale all the pollutants, if you do deep breathing in the polluted environment, so that time indoor exercises are better than outdoor. So that's how the individual should contribute to avoid the effects of pollution.
So how do we create awareness, and what kind of role the government should play here, according to you?
Government's role is mainly to ensure that the laws which exist about control of pollution are implemented, and they also should make the availability of diagnostic facilities for people with respiratory symptoms at the dispensaries which are accessible to the people, and availability of drugs at a reasonable cost, because asthma incidence is increasing, prevalence is increasing, and therefore the inhalers, if they are very expensive, patients avoid taking them. So making drugs which are essential for life to be available at the reasonable cost, and health facility for diagnosis and treatment available at all places. That's extremely important, but most important is control of the environment.
Control environment. So finally, doctor, if you were to sum up, what are the do's and don'ts for those suffering from respiratory diseases?
I think don'ts are number one. Don't indulge into things that are going to aggravate your respiratory symptoms. So have a clear hygiene, good environment, proper nourishing diet, regular exercise. Avoid dusty and polluted environments. Your houses should not be cluttered. Any patient who has asthma, his bedroom he should avoid carpets in the house. He should not have stuffed toys which have lots of house dust mites in them. And I think the do's are, again as I said, good nourishing diet, proper exercise, fresh air. All these are very important, and if you are diagnosed to have a disease, a regular plan of medication should be followed. You should follow up with your doctor at least 3 times a year, whether you are well or unwell, and assess yourself objectively so that your disease does not progress to a worse condition and your life is not in danger.
Doctor, very well put. Thanks a lot for being on the show. It was a pleasure having you here.
Thank you very much.